If you've ever gone to couples therapy or if you ever do, one of the tricky parts is reimbursement through your insurance company. So, in this video, I'm going to talk about why insurance companies often won't pay for couples therapy. Stay tuned. Welcome to Wellness with John. I'm John Peters, and these are resources to help you thrive. So, in this video, I'm going to talk about why you run into some difficulty with getting your insurance company to pay for couples therapy, even if your insurance policy has a benefit for outpatient behavioral health services. So, one of the issues that comes up for us therapists is that the product of insurance coverage is aimed at individuals. And this may not make a lot of sense because as long as we've been thinking about therapy, probably you, just like me, we do think about the target of the therapy often not necessarily being an individual. Because if you think about dysfunction in a relationship or dysfunction in a family, it's easy to understand that it's proper to get therapists to support couples and families in improving their function. It's in the proper focus of providers in the domain of psychology. Like, who else are you going to go to? Your electrician or your plumber, right? You go to a therapist if you want to address dysfunction within a relationship or a family system. So it doesn't make a lot of sense when people find out that the product of insurance coverage is really defined as providing a benefit to an individual. So you don't go shop around for family coverage, for relationship coverage, for an insurance product, right? It's always assigned to an individual for that individual's health care, right? And that's what it reimburses. And this is the limitation, that there just isn't a product that's aimed at anything other than an individual. If there were, then it would make a whole lot of sense in terms of providing billing codes, justification for reimbursement for interventions that focus on couples or more than one person at a time. So the way insurance works is that when you see a provider, the provider diagnoses you. And so when an insurance claim is submitted to an insurance company, it has to have at least one diagnosis. And the service provided has to be to address some aspect of the condition that meets the criteria for that diagnosis. So, to give you an example, if someone sees a therapist and they come in and they say, I'm having panic attacks, then the diagnosis is panic disorder. There are particular billing codes that are used by convention in the industry. And so, as a provider, then you assign panic disorder and the associated code as the diagnosis, and you justify that you're providing some sort of treatment for that particular disorder. That all gets included in the claim that's submitted to the insurance company, and the insurance company then reimburses whatever the covered amount is for that type of service for that condition. So the problem is that the way insurance companies work is that they only reimburse for a certain group of diagnostic codes, okay? And in the field of psychology, the field of psychiatry, there's a whole set of diagnostic codes that are based on the diagnoses that are used by convention in the field. So we have the Diagnostic and Statistical Manual of the APA, which is basically the Bible of diagnosis, and it has 270 some different diagnostic categories in it. Each of those psychiatric disorders, as defined in that whole taxonomy, has associated billing codes. And so basically what insurance companies do is they say, we will, if it's outpatient behavioral health or inpatient behavioral health, we will reimburse for treatment associated with one of those codes. But here's the catch. Um, if you come in as a couple and you say, we're having marital discord is not a psychiatric diagnosis. So therefore, there's no associated code for that. Now, there is a whole section of separate codes that are for things that are of clinical focus but are not psychiatric disorders, and these are often called Z codes because they have a Z at the beginning of them. But basically, marital conflict is not a psychiatric disorder, but it's one of these things that could be of clinical focus, right? So if it's a standalone diagnosis, that's the only thing that you have, then if, as a provider, I put marital discord on the insurance claim form, they'll just reject it, and they'll say they rejected it because I didn't include a diagnosis. Okay. So here's the gray area that people sometimes operate in to get reimbursement for couples therapy or for family therapy. It's considered acceptable if, let's say, we have a client, Joe Smith, and he has clinically significant anxiety and he meets the criteria for, let's say, generalized anxiety disorder. And he is in therapy with a therapist getting individual treatment for his anxiety. If the therapist and the patient at some point think that, okay, it would be supportive of his treatment of his anxiety if we bring in his partner for some sessions because the partner is relevant to whatever the process of the treatment goals might be for the patient, then you can bill that to the insurance company because you have an identified diagnosis, generalized anxiety disorder, and the family treatment, which is the type of service that gets provided to the individual client, is supportive of the individual client's treatment plan. That is covered, okay? But the trick is when you have a couple who, regardless of whether one or both of them meets the criteria for a psychiatric disorder, they go to couples therapy. And then here's the gray area. The question comes up, is the couples therapy really targeting treatment for at least one billable diagnostic category for at least one of the individuals in treatment? Okay. Different therapists have different approaches to this, and some kind of lean toward the more loose end of that and basically say, if I'm seeing a couple or if I'm seeing a family and at least one of them has a billable diagnosis, I'm going to attach that diagnosis and everything's going to be fine. In practice, it generally does work that way. And in 25 years of practice, you know, I haven't actually known of cases where insurance companies audited a treatment plan and then rejected claims because they thought that that approach was being done in too liberal a manner. So what this leads to in the industry is a lot of therapists being fairly loose with that. So the bottom line is, if you go to therapy and at least one of you is covered, you might get that reimbursed if the therapist is kind of taking that tack of a more kind of loose end of how to include the justification for the treatment. But some of us hew in the opposite direction. I'm personally somewhat conservative about this, that even if one of the people has a clinically significant diagnosis, it may be the case that the treatment of the couple or the family is really not primarily focused on treating that individual's diagnosis. Okay, so what that means is that there are cases where you go to see a couples therapy and the couples therapist basically says you have to pay out of pocket even if you have insurance coverage for outpatient behavioral health services, because what I'm doing with you is not really treatment for a billable code. Okay. So that's kind of the situation that you get into. Um, and maybe that emerges later in the process. I mean, it is also possible that you start off as a private pay client, and at some point, the therapist might reevaluate that and think, okay, what we're doing here is a reasonably justifiable situation where you could submit a claim to your insurance company. But um, just know that um, because of this limitation and the way the system works, that if you go see couples therapy, and you may have a very valid reason to go see a couples therapist, that you may end up having to pay out of pocket because of the problem with getting the claim submitted. Now, in a more perfect world, again, what insurance companies would do is pay for those Z codes that include things like marital discord, right? I run into this also with my divorcing patients because I specialize in treating people for coping with co-parenting after separation. And while it's true, sometimes that is justified because the person is having clinically significant symptoms of, let's say, adjustment, which allows for a billable code to be assigned. Sometimes the primary focus is with individuals who are really pretty free of frank psychiatric distress, and it's challenging to think about how to justify assigning a billable code to the service, and therefore the people end up having to pay out of pocket. So anyway, I just want to make this explanatory video because over the years I have had lots of people get confused about, well, when I go see my individual therapist, I get reimbursed, and now I go to see this couples therapist and we're having to pay out of pocket. So that's the main issue that comes up, that ends up in causing an encumbrance of additional fees out of pocket for people. The other thing is sometimes people go see marriage therapists who aren't really fully credentialed, and they tend to call themselves counselors, even though some of us who do have full clinical credentials say that we're counselors and that we're doing counseling. But there are people who don't have the credential to be able to bill an insurance policy, and yet they're doing something that's really more akin to coaching, and they're coaching people with couples counseling about relationship issues, which is fine if you're seeing someone who's competent and who serves you well given what you want to get out of the process. I'm not poo-pooing that. But for those people, they're not going to be able to bill your insurance because they don't have the proper credential to be able to say, I am a service provider who can actually get reimbursement for providing this service. You're really seeing a coach, and coaches aren't reimbursed by insurance no matter what, right? So anyway, hope this is informative. If you like this kind of content, hit the like button below, please. If you have yet to subscribe to my channel, please subscribe because I would love to grow my subscriber count on the channel, and I'll see you in an upcoming video.